Good morning, everyone. I'd like to begin by sharing a poem that I read this week. I'm wearing a pair of shoes. They are ugly shoes, uncomfortable shoes. I hate my shoes. Every day I wear these shoes, and every day I wish I had a different pair. Some days my shoes hurt so bad that I do not think I can take another step, yet I continue to wear them. I get funny looks wearing these shoes, looks of sympathy. I can tell in others' eyes that they are glad they are my shoes and not theirs. They never talk about my shoes. To learn how awful my shoes are might make them uncomfortable. To truly understand these shoes, you must walk in them. Once you put them on, you can never take them off. I now realize that I am not the only woman wearing these shoes. There are many pairs in the world. Some people are like me and ache daily as they try to walk in them. Some have learned how to walk in them so they don't hurt quite so bad. Some have worn their shoes for so long that days go by before they think about how much they hurt. No one deserves to wear these shoes, yet because of these shoes, I am a stronger person. These shoes have given me the strength to face anything. They have made me who I am. I will forever walk in the shoes of a person who has cancer. My name is Sara Murphy, and I am one of the 350 or so Irish women who were diagnosed last year with ovarian cancer. I was 38 years old, married to my fantastic husband Ger for 7 years, 2 beautiful children. Cathal was 3 and Tara was 1, and I had just returned to my job as a paediatric physiotherapist after my maternity leave with Tara. Life was frantic with a full-time job and 2 small kids. I was in the process of trying to reduce my work hours as I was tired and I was finding it tough going. I'd never taken a day off work up to this point. Thankfully, I had never been unwell. As a matter of fact, I'd never taken a course of antibiotics. I just wasn't prone to chest infections or anything like that. In hindsight, my first symptom was about 8 months before diagnosis. I had severe stabbing pain in my abdomen one day, and I went to my GP to follow it up. I didn't have the pain on the day I saw her, so she referred me for an abdominal ultrasound, as she thought it might be gallstones. It was unfortunate that a pelvic ultrasound wasn't done on that day too. Over the next few months, I was tired, uncomfortable, urinating too frequently day and night. I spoke to my GP about it, querying diabetes or thyroid, as I was trying hard to lose weight and it wasn't coming off. She reminded me that my bloods were okay, that my ultrasound was clear, and I needed to join Weight Watchers. Then I started to have some constant niggling pain on my right side. If I yawned or coughed, it hurt. I couldn't sit comfortably. I couldn't lie on my side at night. The pain got progressively worse. Over a period of about 6 weeks, I was going to the GP about once a week for stronger and stronger painkillers. I went from Panadol to Solpadeine, to Solpadol, Tramadol, and once she prescribed Valium for the pain, I knew that I needed to get to the bottom of it. Despite all the nausea and diarrhea I was having, I'd put on another stone in weight, and I'd been asked a few times when was I due. I'd been sent to a physiotherapist to treat the back pain, but I knew this wasn't musculoskeletal, and between us, we convinced the GP to order a scan. A thoracic lumbar MRI showed degenerative changes in my lumbar spine and some fluid in my lungs. The GP said to continue with the physiotherapy, but I knew that the pain in my side was not coming from my back. The following week, my workplace was closing for 2 weeks' summer holidays, and I was determined not to have my holidays with the kids spoiled by being so unwell. So in desperation, I made another visit to the GP. As luck would have it, there was a locum GP there, and she insisted I go straight to A&E without delay. Never once in this time did cancer cross my mind. I have no family members, nor did I really know anyone personally who had cancer. After a night in accident and emergency, I was admitted, had a CT scan, and told I had an 8-centimetre cyst on my right ovary. I was so relieved that they found something. I really thought I was losing my mind. The lack of sleep, the Valium that I was taking were really messing with my head. I was transferred to the maternity hospital and had some more tests and waited for a consult. The on-call gynae consult who came to tell me that I had ovarian cancer was so kind. She sat on the bed, she held my hand and told me that I had a long, hard road in front of me. She seemed shocked at my diagnosis. I had none of the typical risk factors. I was young, not postmenopausal. I had taken the pill for almost 10 years. I had given birth twice. I will never forget Dr. Suzanne O'Sullivan's kindness on that day. She came back to check on me later when her shift was over, even though I was not her patient. A part of me died that day in room 37 in the maternity hospital in Cork. My dreams of a family life, of motherhood, of seeing my children go to school, get married, and have children of their own. All of those hopes and aspirations died when I heard the word cancer. Telling my sister and my parents was really the hardest thing. I hated hurting them so much. My dad literally had a heart attack. He clutched his heart and had to be sent for an echocardiogram. He had slipped into AFib, a condition he suffered with a few years before. So then began my journey with cancer. I learned a whole new language that I never knew anything about. Stages, grades, cell types, oncology, radiology, chemotherapy, biological agents. I was staged at stage 4 as the cancer had spread throughout my abdomen and to my organs, lungs, bowel, liver. Even as I speak these words, and after all I've been through, it still feels surreal, as if it's not happening to me and as if it's happening to someone else. Everything happened very quickly after that. I was told that surgery was not an option as the disease was too extensive. So I started chemotherapy within a week of diagnosis. I had 4 chemo sessions with carbotaxol Avastin, and I had a very good response to this. So I then had a radical hysterectomy. I can't use the word debulked. I think it's such a horrible word. I can't use it to describe myself. I then completed the final 2 of the 6 chemo sessions last February. I've been on maintenance Avastin infusions every 3 weeks since then. I had 2 CT scans this year in May and October, and I have no evidence of disease at this time. My CA125 is stable at 10 since surgery. I was told that due to the advanced stage of my cancer that there was no cure, that I would be having palliative treatment. And when I asked initially what my prognosis was, the surgeon said typically 6 months to 2 years. I might go under a bus tomorrow, but I hope to outlive the 2-year prognosis. I have a bit too much to do. I have a very special Christmas planned with my kids. We're hoping to go to Euro Disney next February, and then I turn 40 and I'm going to celebrate it. I have no wish list, no bucket list, and no regrets. I feel very lucky to be here. I try to value the relationships I have with the important people in my life. I try very hard to spend quality time with them, and I try not to let things go by without fully experiencing them. I'm profoundly grateful for the love and support of my family and friends, for I could not have endured this without them. I'm afraid I can't say that I find my cancer as a gift, but I have experienced some wonderful things since having cancer. Most importantly, I've seen my son turn 5 and my daughter turn 3, and I've gotten to know them very well this last year. I'm amazed at all the love and support that I've been shown, often from the most unlikely sources. I've met some wonderful, inspirational women in the oncology day ward and at these patient days. I know too that some women have lost their battle. My friend Julie Byrne came to the last Overcare patient day in Cork with me, and she passed away in July. I cannot speak about my disease without speaking about my oncologist. Professor Seamus O'Reilly is quite simply a wonderful, honest, straight-talking doctor. If he told me to stand on my head, I would question him so I could understand his reasoning, but I would do it. I trust him completely, and that trust is essential. I know that if and when my disease recurs, he will have another treatment option for me. So what have I learned on this cancer journey that I can share? The statistics are not encouraging, but we are all unique in how we present and in how we respond to treatment and in how we handle the disease. Every year, as treatments improve, more women survive. Cancer is a very lonely place. Friends and family who have not experienced it cannot relate to it. They cannot understand the sense of loss that accompanies cancer, the enormity of it all. I cannot forget that I have cancer, but I've learned to walk alongside it, to make peace with it, and that I can have a life outside it. My husband's favourite movie is Shawshank Redemption, and one of the famous quotes from this movie has become my mantra: get busy living or get busy dying. It's a good mantra for me, and picking up after my 2 fairies at home keeps me as busy as I need to be. Thank you very much.